Hello, I'm Dr. Rohini. Today I'm going to talk about hysterosalpingography, that is HSG. So today I'm going to discuss the importance of the test, how is it done, and when it should be done. So first of all, HSG, a lot of people commonly don't understand when we say HSG. They understand when we say it's tube testing. So correctly, as you can understand, so this test is done usually primarily to check the fallopian tubes. So for a woman to get pregnant, she has to have healthy ovaries, uterus, as well as tubes. So in case of HSG, this is an X-ray procedure which would help us to see the uterus as well as the tubes. It will give us an idea what is the shape of the uterus, whether it is of any abnormal shape, and it will also give us an idea the shape of the fallopian tubes and whether the tubes are open or not.
When is it done?
This test is ideally done when the bleeding stops completely, and it is done usually around 7 to 10 days of your menstrual cycle. It is not done beyond that because this is an X-ray procedure. So there is a risk of radiation. So in case there is chances that after 10 days that you may have ovulation, it may affect the growing egg, and if there is a pregnancy, it can affect the pregnancy. So this procedure is done before 10 days.
When is it performed?
When a patient comes to a fertility clinic, we do not directly jump onto and give her a tube test or HSG procedure. Initially, we check her, we do ultrasound, we do hormonal evaluation, and we give, if the patient is a young patient, we give her a trial for 1 or 2 months. We give her tablets for induce ovulation, and if she doesn't conceive after 1 or 2 months, then we suspect that maybe some problem with the tubes, and we send advisor HSG. Or there may be other situations where previous patients would have had a previous abortion, or there is any history of tuberculosis or any history of pelvic inflammatory disease, or when patient is complaining of severe abdominal pain, or she has had history of ectopic pregnancy, that is pregnancy which has been in the tube previously. In these situations, we advise this test earlier.
How is it done?
Like I told you, it is done between 6 to 10 days, and it is done in a setup which has X-ray facilities. And for this test, you need not go fasting. You can have some light breakfast or lunch, and you can have food and go. During the procedure, just like a vaginal scan, you would be put up in a position where you will be lying on your back, and then we would be using a speculum to visualize your cervix, and then we would be inserting a small plastic cannula or a catheter inside your cervix, that is your mouth of the uterus, and then the X-ray would be positioned on top of your pelvis, and then we would be injecting a dye, which is a radio opaque dye, into the uterus, and we would be taking shots, or we would be taking pictures of the uterus when this dye is being injected. So these X-ray films will give an idea about the shape of the uterus, whether it is of normal shape or if there's any abnormality, and it will also give us an idea the shape of the tubes, and if there is any if the tube is blocked or open.
Which medications should be taken after the procedure?
So before the procedure, ideally we give some tablets. Either we can give some injection like Drotin injection, or we give tablets like painkiller basically, or the antispasmodics of any kind. 1 hour or half an hour before the procedure we give it, so that the patient experiences less pain. And sometimes we have seen that the tube goes into spasm, and it gives a false result. That is, the tube may not be blocked, but when patient experiences pain, the tubes also kind of constrict, and we get a false information. So that this should not happen, we usually give some painkillers before the procedure, and after the procedure we give antibiotics to the patient. That has to be taken for at least 3 to 5 days to prevent any infection because of the procedure.
Is it painful?
Yes, it is not like an ultrasound. Since we are going to put a cannula inside your uterus, it does cause mild to moderate discomfort in patients, but again the pain threshold is different for different women. And in case if you are very anxious and you feel very scared and afraid of the pain, then this procedure can also be done under sedation in very few patients. Depends on the patient's comfort level.
Is rest required after the procedure?
No, There is no need for any rest. In case if you have any discomfort, you can take a rest for an hour or two, but you can resume your normal activities the next day. You don't have to take bed rest or anything for this.
Tube blockage. What's the next necessary step?
So next would be, see, this test is like a screening test. It would not give you a confirmatory idea. Yes, if the tubes are open and there is spillage of dye, then you know for sure that the tubes are open. But if it is blocked, it doesn't mean that for sure it's blocked. The next step would be to do a confirmatory test. That would be doing a laparoscopy testing. In laparoscopy, basically, we would be directly able to visualize, inject the dye and see whether there is spillage of dye on both sides or not. Next, one more question that patients ask is, will HSG affect my ovaries? Which will it cause any harm? No, it does not. It even doesn't affect ovulation. In fact, what we have noticed is that after doing a HSG, there is increased chances of conception in the next 2 to 3 cycles. That happens because when we push the dye, if there are some dirt or some small debris which have been blocking the tube, they get flushed out. So they increase the chances of conception in the next 2 to 3 months. There are few conditions where we do not do HSG to the patient. For example, if we suspect that there is some infection in the tubes, that we would get to know by patient symptoms. If she says she has a lot of white discharge, if she has pain in her tummy, in these situations we do not do HSG because it causes spread of infection, further spread of infection. So that has to be ruled out. So that's why you should not go and do this test on your own. It has to be advised by the experts. You have to come to us, we will assess you, do a scan, and once we are sure, we will refer you to the scan center or whichever setup has this facility.
Are there any side effects of the HSG test?
No, there are some side effects that you can experience after HSG. That is, you may experience some abdominal pain, excessive bleeding, or there may be foul smelling white discharge, or you may expect fever with chills. And in these situations, we would want you to come back to us and we would evaluate you why this is happening, because yes, patients do experience some amount of discomfort after the procedure, but it shouldn't be, one of these symptoms should not be there. And so how do you prepare for this test is, like I told you, what is going to happen in the test. So since you may experience some discomfort, I know there is a lot of anxiety associated with this test, so it's better to go with someone, not alone. Be mentally prepared, not be very stressed out before the test, have food, and take your painkillers on time. And best is to have complete information what you're going to go through. So this will help you to deal with the test better. I hope I have answered all your doubts regarding this test. And in case if you have any further queries, you can always come and meet us in person or contact us on our phone number. Thank you.